Hello, this is Ken from KBDProductionsTV. I just had eye surgery and I thought I'd do a little video on surviving eye surgery. It's not as bad as I thought it was going to be. I was pretty scared about going to the eye surgeon, and so I was going to keep this eye closed because both eyes want to open, and when you have a patch over one eye it's not fun because it keeps wanting to open in your eyelashes anyway. So I had a sty on my eye in November. It was like a large bump on the eyelid. Sometime in January, I think I went to see my doctor about it. He said go to an eye specialist. So I went to the eye specialist a couple months later because they're so backlogged, and then he said, yeah, it's a sty on the eye and eyelid. So he set me up for surgery, which I just had a couple hours ago. I went into the surgery and just lied on a gurney inside like a doctor's room type thing at the hospital, and they put drops in my eyes that makes your eye, all the skin around your eyes and your eyelids, makes them freeze, and or it numbs them so you can't really feel them at all. And then they flip your eyelid, put a clamp on it, flip your eyelid. I guess the brutal thing about this was I thought I'd have to see what they were doing because they needed your eyelid to be flipped open, so I thought I could have to see what instruments were coming towards, needles and cauterizers and stuff. But the way he did it, he flipped it and the eyelid was pushed down enough that I couldn't see anything that he was doing. So when they put the clamp on, they flipped my eyelid. I could feel the pressure of it, but it didn't hurt. I could feel the needle going into the eyelid itself, but that didn't hurt either. Again, just felt like pressure. And then he proceeded to, I guess, cut it open. I guess the worst part was the smell of the burning when they cauterize it, and so that's not fun at all. At one point the nurse said, release your fingers, because I had my fingers crossed like this over my stomach, and I guess I was clenching so hard that my fingers had turned purple. So she said, release your fingers so you can get the circulation back. And so I did that, and so after they cauterized it, then he put ointment in it, and then bandaged it up. And all in all, it was actually not that bad. I thought it was going to be way scarier. I actually thought I should have been put out, but it wasn't that bad. Now I'm starting to get a sty on this eye, but he just said put some hot compresses on it and it should go away. Couple other things. This is the cost. This used to be covered by OHIP, which is the Ontario Health Insurance Plan, but this wasn't covered under that, so I had to pay out of my own pocket. So the hospital fee was $231, and you could pay with Visa, but the doctor's fee was separate, so I had to give him cash or a check. So I gave him cash, and it was $125. And that's about it. Well, all in all, the surgery went well. Like I said, it wasn't as scary as I thought it was going to be, so if you have to have the surgery, don't fret it, and keep your fingers uncoupled so you don't lose the feeling in them. Thanks. Talk to you later. Bye.